We will discuss about today our topic is subclavian artery. Always you have to remember the subclavian artery, which is this is the left side of the cadaver and this is the right side of the cadaver. On the left side of the cadaver, the subclavian artery, which is arise from the directly from the arch of aorta. Here you can see this is the subclavian artery and this is the common carotid artery. Both are arise from the heart, from the arch of aorta. You can see, and on the right side, the subclavian artery, which is coming from the brachiocephalic trunk. So the left side, which is comparatively longer as compared to the right sides, and the subclavian artery, it is a on the left side, it is a branch of arch of aorta, and behind to the sternoclavicular joint and the uh, upper part of the manubrium, sternomanubrial joint, it is start. Now you always remember these calcaneus anterior muscles which divide the subclavian artery into the three part. Proximal to it first part, behind to it it is the second part, and distal to it is the third part. Third part, which is outer border of the first rib, it becomes continuous as a axillary artery. So now inside the axilla it becomes axillary artery, and always you have to remember the subclavian vein which is passes anterior to the scalenus anterior, and the subclavian artery which is passes behind to the scalenus anterior. Now we will discuss about the relations of the subclavian artery. First part, which is related with the uh, anteriorly by the skin, superficial fascia, sternocleidomastoid muscles, and posteriorly you always remember suprapleural membrane, and there is a apex of the lung on the first part. You always remember throughout this subclavian artery posteriorly related with the apex of the lung, suprapleural membrane. These are the common relation on the posterior surface. But anteriorly in first part there is a sternocleidomastoid muscles and infrared muscles, as well as there is a portions of the vagus. This is this now it is the always you have to remember the anterior to the scalenus anterior, the nerve which is passes, it is the phrenic nerve, and this phrenic nerve which is formed by the C3, C4 and C5. So this phrenic nerve supplies to the diaphragm, and now we will discuss the scalenus anterior divide the subclavian artery into the three part. Proximal to it, it is the first part. Behind to the subclavian, it is second part, and distal to it is the third part. The first part, it gives the first branch. Here you can, it goes inside the vertebra. It is the first branch, it is a vertebral artery, and it is enter into the intervertebral cervical intervertebral foramen, and it is goes inside the skull through the foramen magnum, and it makes both side of the vertebral artery united, it makes the basilar, and it makes the circle of Willis, and it gives the branches to the brain. Another branch, here you can see this is the first part. It gives the branch which is goes downwards on the above to the suprapleural membrane, and here you can also see this artery. It is the internal thoracic artery. So this internal thoracic artery here, it is the supplies to the intercostal spaces, into the upper 9 intercostal space. It is supplied by the internal thoracic. Third branch, it is the thyrocervical trunk. This thyrocervical trunk, it divide into the three branches. First branch is here you can see this is a branch which is called the inferior thyrocervical trunk. It gives the inferior thyroid artery, and this inferior thyroid artery goes medially and it supplies to the thyroid gland. Here you can see this is a supplies to the thyroid gland. It is the inferior thyroid artery, passes to the behind to the carotid sheath. Second branch, it is called it is the transverse cervical artery. This is the transverse cervical artery, and it is supplies to inside the neck region. And third branch, it is the suprascapular branch of the thyrocervical trunk. And this suprascapular, along with the suprascapular nerve, and it supplies to the muscles around to the scapula, subscapular region. So first part we already discussed. First part, it gives us vertebral artery. Another is the internal thoracic artery and thyrocervical trunk. Thyrocervical trunk again divide into the three branches: inferior thyroid, transverse cervical, and suprascapular artery. And the second part, which is normally either first part, this is the behind to the subclavian scalenus anterior, it is the costocervical trunk. And this costocervical trunk, normally inside the left side, it is a branch of first part of the subclavian artery. Sometime it is the second part of the subclavian artery, and it gives the branches by the costocervical trunk by the superior intercostals. This is the superior intercostals, and it gives the deep cervical branches. This is the deep cervical branches. Here also, this subclavian artery, it gives the deep cervical branch which is coming from inner sides. It is a larger branch. It is considered as a deep cervical artery. The third part of the subclavian artery, sometimes it gives the branches. It is the dorsal scapular artery, and this is the dorsal scapular. And outer border of first rib, it becomes continuous as a axillary artery. So the second part also anteriorly related by the phrenic nerve, scalenus anterior, as well as there is a subclavian vein. The posteriorly, it is related with the first intercostal space, and there is a also there is a suprapleural membrane. It is a posterior relations of the subclavian artery. Uh, Suprapleural membrane as well as cervical pleura and lower trunk of the brachial plexus, which is the posterior relations of the second part of the subclavian artery. Third part of the subclavian artery, the anteriorly, we already middle part of the clavicle, middle one third of the clavicle, subclavian vein, and external jugular vein. We already cut the external jugular vein, and the posteriorly, it is also related with the suprapleural membrane, and there is a cervical pleura, and also it is related by the scalenus medius muscles. This is a scalenus medius muscles. So in between the scalenus anterior and medius, there is a brachial plexus, all three trunk of the brachial plexus, and as well as the subclavian artery passes in between the scalenus anterior and medius muscle. Scalenus vein, subclavian vein, which is passes anterior to the scalenus anterior, but the artery and the brachial plexus, which is passes between the scalenus anterior and scalenus medius muscles. So this is about to the branches of the subclavian artery. On the left side, it is begin from the arch of aorta. On the right side, it is the branch of the brachiocephalic trunk. So hope you understand the subclavian artery.